Hello po, ang topic po natin today ay endometrial cancer or cancer sa matris. Ano po ba ang endometrial cancer? Ito po ay type of cancer that begins in the uterus, dun po sa matris. And it begins in the layer of cells that forms the lining of the uterus. Very common po ito na cancer affecting yung female reproductive organs. At ano po ba ang mga sintomas ng endometrial cancer? Meron pong pagkakaroon po ng abnormal vaginal bleeding or discharges. Meron na pong mga lumalabas. It may range from pink and watery to thick, brown and foul-smelling discharges. Merong unusual, heavy irregular menstrual periods. Merong vaginal bleeding after menopause. Merong bleeding between periods. Maaring merong difficult or painful urination. May pelvic pain or pain habang nagtatalik po ang mag-asawa o mag-partner. There is unexpected weight loss. Ibig sabihin po, hindi mo sinasadyang magpapayat pero ikaw ay namamayat. There is enlarged uterus. Detectable to during pelvic examination. At tandaan po sa mga premenopausal women, yung mga hindi pa nagme-menopause, abnormal vaginal bleeding meaning irregular menstrual bleeding, merong spotting, merong bleeding between periods. At doon po sa mga kababaihan na postmenopausal na, any vaginal bleeding is abnormal. Maari ding nakakaranas ang isang babae ng panghihina o napapagod. There is pain in the lower abdomen. Bloated siya, feeling full siya, mabilis siyang mabusog pag kumakain siya. There is changes in the bowel or bladder habits. There is pain in the back or sa kanyang legs. Ito po ay when the cancer has spread to other organ. At ano po ba ang mga risk factors? Ito po ang edad. Ang edad ng kababaihan pagka nakarating na po siya ng menopausal period and they are in their mid-60s or maari din sa mga kababaihan na age between 45 to 74 or premenopausal period. Ibang risk factors po ay yung level of hormones. Yung hormones na sinasabing tinatawag nating estrogen and progesterone. Pag merong fluctuations, ito po ang nagkukos ng changes dun sa layer or lining ng endometrium or lining ng matris, and they become too thick. Ito po yung sinasabing pangangapal ng lining ng matris. O dun sa mga kababaihan na hindi pa nakarating dun sa menopause period, merong irregular menstrual periods. And during premenopause and menopause, at ganun din sa mga kababaihan na na-diagnose ng PCOS or PCOS, ibig sabihin po yung mga na-diagnose ng polycystic ovary. Maari din pong risk factor ang pagiging overweight kung meron kang body mass index greater than 25 o yung mga nagtitake po ng hormones like estrogen. And some studies suggest po na longer years of menstruation. Ibig sabihin po, you started menstruating at an early age before 12 and you stopped late. The more periods you have had, sabi po nila, the more exposure your endometrium has had to estrogen. Isang risk factor po, never having pregnant. And as women grow older, yung risk po ay nag-i-increase. So ano po ba, paano po ma-diagnose ng doktor na meron kang endometrial cancer? Tandaan po lamang yung Pap test or yung Pap smear. Hindi po na-check or hindi po nakikita po dito kung meron kang endometrial cancer o wala. So una pong diagnosing tool ay yung pelvic examination. Pangalawa po yung transvaginal ultrasound o tinatawag naming trans-V. Ito po, makikita po yung thickness and texture ng endometrium ng uterus. Yung hysteroscopy, kung saan po yung doktor, he uses a thin, flexible lighted tube, i-insert po dun sa ari ng babae at through the cervix at makikita po yung loob ng matres. Yung lens po allows the doctor to examine the inside of the uterus and endometrium. Another test po is removing a sample tissue for testing. Ito po yung tinatawag na biopsy for laboratory analysis. And another thing, yung DNC or dilatation and curetage. So during the procedure, yung tissue po ay i-scraped at isesend po for examination of cancer cells. At meron din po tinatawag ng mga doktor na staging. Ito po yung extent ng cancer, kung kumalat na po ba o localized pa dun sa area kung saan siya tumubo. At mga ibang diagnosing tools ay yung chest x-ray, yung CT scan or computed tomography, yung PET scan, maaari din pong mga blood tests, at yung final na determination kung ano pong stage yung cancer ay when you undergo surgery to treat the cancer. At usually po ang treatment, after na na-diagnose ang isang babae na meron siyang endometrial cancer, ay usually po surgery, kung saan aalisin po yung matris, yung fallopian tubes, kasama po yung ovaries. At pagkatapos po nito, wala ka ng chance na mabuntis ulit, and you will experience menopause. Other options po ay radiation therapy. But if you are not healthy enough to undergo operation, you may opt radiation therapy only. Another thing po is chemotherapy. One or two or more combinations of drugs. It can be tableta, a pill, or yung intravenous, yung pinapadaan po sa ugat. At sometimes po, combination ng treatment. Kagaya po nitong hormone therapy. This is to lower the hormone levels in the body. Kasi po yung cancer cells, they rely on the hormones to grow. So, isa po itong option if you have advanced cancer that has spread beyond the uterus. Another thing po is immunotherapy. This is to help the immune system fight the cancer. Ito po ay if the cancer is advanced and other treatments have not helped. At tandaan po, ito po yung mga tips lamang para ma-recognize po natin ng maaga yung mga signs and symptoms at magpatingin po tayo sa doktor. Mas maigi po na makuha po natin ang kanilang opinion para po mas maaga po ang gamutan. Remember, prevention is better than cure. Thank you for watching. And please subscribe po kung hindi pa po kayo nakaka-subscribe, and click the bell down below para po ma-notify kayo sa mga susunod pang mga ma-upload na videos. Hello po, ang topic po natin today ay endometrial cancer or cancer sa matris. Ano po ba ang endometrial